Today, the deadly health crisis raging out of control all across the country that no one is talking about. It's the other pandemic in the shadow of COVID-19, the one you can't study in a test tube. I'm talking about the dramatic rise in overdose deaths, which could be up 25% in 2020. I want you to stop what you're doing and watch this show. Because even if you aren't scared of getting COVID-19, you should be worried about the effect this is having on your community.
Red Star 71, 631, overdose.
I don't feel a pulse. Overdose.
Heroin?
Yes. Keep going. 1, 2, 3. There's a bad batch going around.
The opioid epidemic in this country is a fire that's been raging for years.
Go.
The drugs that we're seeing that people are using or abusing are heroin, methamphetamine, pills of just a complete array of pills, with a lot of times whatever they can get their hands on.
Andrea Dornan, now a paramedic fighting the opioid crisis, struggled with substance abuse in the past. When the pandemic hit last spring, she says it only fanned the flames, making the opioid problem worse.
COVID has had an impact on everyone with social distancing, and people have been able to see family in the past, and now they're unable to because of underlying health reasons, and they're self-medicating with drugs and overdosing, unfortunately.
New numbers from the CDC confirm that. In the first 3 months of the pandemic, we saw over 3 times as many overdose deaths per month. A grim statistic that has caught the attention of our nation's highest-ranking doctor, Surgeon General Jerome Adams.
Anytime you have despair out there, people will self-medicate with a variety of substances. And all of these things are going up in the midst of the pandemic because, unfortunately, the physical distancing, which helps limit the spread of COVID, is exactly the opposite of what we tell people to do to promote mental health and wellness.